Angina pectoris. Angina pectoris, also known as angina, is a medical condition. It is characterized by chest pain or discomfort caused by a reduced blood supply to the heart muscle. It is a common symptom of coronary artery disease, CAD. CAD is a condition where the arteries that supply blood to the heart become narrowed or blocked due to the buildup of fatty deposits, plaques. Angina typically presents as a squeezing, tightness, pressure, or burning sensation in the chest. It may also radiate to the arms, shoulders, neck, jaw, back, or stomach. The pain usually lasts for a few minutes and may be triggered by physical exertion, emotional stress, cold weather, or a heavy meal. There are three main types of angina. 1. Stable angina. This is the most common type of angina and occurs when the heart is working harder than usual, such as during exercise or physical activity. The pain is predictable and typically goes away with rest or medication. 2. Unstable angina. This is a more severe form of angina that occurs at rest or with minimal exertion. And the pain may be more severe and last longer than with stable angina. Unstable angina is a medical emergency as it can be a sign of an impending heart attack. 3. Variant angina. This type of angina is caused by a spasm in the coronary arteries that reduces blood flow to the heart muscle. It may occur at rest and is often accompanied by a temporary change in the electrocardiogram, ECG, readings. 4. Microvascular angina, MVA, is a type of angina pectoris that occurs when there is a problem with the small blood vessels, microvasculature, in the heart. It is also known as cardiac syndrome X or non-obstructive coronary artery disease. In MVA, the coronary arteries appear normal on angiography. But there is reduced blood flow to the heart due to dysfunction or constriction of the small blood vessels that supply oxygen and nutrients to the heart muscle. This leads to chest pain or discomfort that is similar to the pain experienced in traditional angina. But it may last longer and be more difficult to treat. The exact cause of MVA is not known, but it is thought to be related to problems with the inner lining of the blood vessels, endothelial dysfunction, or inflammation. Risk factors for MVA include hypertension, diabetes, high cholesterol, obesity, smoking, and stress. The diagnosis of MVA is challenging as it requires specialized testing such as coronary reactivity testing, which measures blood flow and changes in the diameter of the small blood vessels in response to medications. Treatment options may include lifestyle modifications such as a healthy diet, regular exercise, and stress reduction, as well as medications such as calcium channel blockers, nitrates, or ranolazine. In some cases, referral to a specialized center for further testing and management may be necessary. Stable angina. What stable angina feels like and when you might feel it. Stable angina is a type of angina pectoris that typically presents as a discomfort, pressure, tightness, or squeezing sensation in the chest. It may also be described as a burning, heaviness, or fullness sensation. The pain or discomfort usually occurs behind the breastbone and may radiate to the arms, usually the left arm, neck, jaw, shoulders, or back. The pain or discomfort of stable angina is usually triggered by physical exertion or emotional stress, and it typically goes away with rest or medication. It may also be associated with shortness of breath, sweating, nausea, or lightheadedness. People with stable angina may experience symptoms during activities such as walking, climbing stairs, or carrying heavy objects. The symptoms may also occur during exposure to cold weather, after a heavy meal, or after consuming alcohol or tobacco. The symptoms of stable angina are usually predictable and can be relieved with medications such as nitroglycerin. However, if the symptoms become more severe, occur at rest, or last longer than usual, it may be a sign of unstable angina or a heart attack and requires immediate medical attention. What unstable angina feels like and when you might feel it. Unstable angina is a type of angina pectoris that is considered a medical emergency as it may be a warning sign of an impending heart attack. The symptoms of unstable angina are similar to those of stable angina, but they are more severe and unpredictable. Unstable angina may present as chest pain or discomfort that is more intense, lasts longer, and occurs more frequently than in stable angina. The pain may occur at rest or with minimal exertion and may not be relieved with medications such as nitroglycerin. The pain or discomfort may also occur without a trigger and may be accompanied by shortness of breath, sweating, nausea, or lightheadedness. Unstable angina may occur suddenly, and the symptoms may increase in frequency and severity over time. It may also occur after a heart attack or during recovery from a heart procedure such as angioplasty or bypass surgery. Unstable angina requires immediate medical attention as it may be a sign of an impending heart attack. Treatment may include medication to control chest pain and blood thinners to prevent blood clots from forming in the arteries. In some cases, angioplasty or bypass surgery may be necessary to improve blood flow to the heart. What variant angina feels like and when you might feel it. Variant angina is also known as Prinzmetal's angina or vasospastic angina. It is a type of anginapectoris that occurs due to spasms in the coronary arteries that supply blood to the heart muscle. Unlike stable and unstable angina, variant angina often occurs at rest and can happen at any time of the day or night. The symptoms of variant angina may present as chest pain or discomfort that is similar to stable angina. But it is often more severe and may feel like a squeezing or crushing sensation in the chest. The pain or discomfort may last for several minutes and may be accompanied by other symptoms such as shortness of breath, sweating, nausea, or palpitations. Variant angina may also be triggered by exposure to cold weather, emotional stress, or the use of certain medications or drugs that constrict the blood vessels, such as cocaine or amphetamines. Symptoms. The symptoms of variant angina usually respond well to medications that relax the blood vessels, such as calcium channel blockers or nitrates. In some cases, medications such as aspirin or blood thinners may be prescribed to reduce the risk of blood clots forming in the arteries. In rare cases, angioplasty or bypass surgery may be necessary to treat severe or recurrent symptoms. What microvascular angina feels like and when you might feel it. Microvascular angina, MVA, is a type of angina pectoris that occurs due to reduced blood flow to the heart muscle through the small blood vessels, microvasculature, in the heart. The symptoms of MVA may present as chest pain or discomfort that is similar to stable angina, but it is often more diffuse and may last longer. The pain or discomfort of MVA may be described as a burning, squeezing, pressure-like, or tightness sensation in the chest. It may also be felt in other areas such as the neck, jaw, back, or arms. The pain or discomfort may occur at rest or with minimal exertion, and it may not be relieved with medications such as nitroglycerin. In some cases, MVA may be associated with other symptoms such as shortness of breath, fatigue, or dizziness. MVA may occur in people who have risk factors such as hypertension, diabetes, high cholesterol, obesity, smoking, or stress. The symptoms may be triggered by physical or emotional stress, exposure to cold weather, or after consuming alcohol or tobacco. The diagnosis of MVA may be challenging as it requires specialized testing such as coronary reactivity testing, which measures blood flow and changes in the diameter of the small blood vessels in response to medications. The treatment of MVA may include lifestyle modifications such as a healthy diet, regular exercise, and stress reduction, as well as medications such as calcium channel blockers, nitrates, or ranolazine. In some cases, referral to a specialized center for further testing and management may be necessary. How is angina different from a heart attack? Angina and heart attack are both related to problems with the blood flow to the heart, but they are different conditions with different causes and outcomes. Angina is a type of chest pain or discomfort that occurs due to reduced blood flow to the heart muscle. It is usually triggered by physical or emotional stress and relieved with rest or medications such as nitroglycerin. Angina is not typically associated with permanent damage to the heart muscle and does not cause a heart attack. A heart attack, on the other hand, occurs when a blockage in one or more of the coronary arteries, the blood vessels that supply blood to the heart, prevents blood flow to a part of the heart muscle. This results in damage to the heart muscle and can be life-threatening. The symptoms of a heart attack may include chest pain or discomfort, shortness of breath, sweating, nausea, or lightheadedness. The pain or discomfort of a heart attack may be more severe and longer lasting than that of angina, and it may not be relieved with rest or medication. The treatment of angina typically involves medications such as nitroglycerin, beta blockers, or calcium channel blockers, as well as lifestyle modifications such as a healthy diet, regular exercise, and stress reduction. Heart attack. The treatment of a heart attack involves emergency medical care to restore blood flow to the affected part of the heart, which may include medications such as aspirin and thrombolytics, or procedures such as angioplasty or bypass surgery. In summary, angina is a warning sign of reduced blood flow to the heart muscle, while a heart attack is a medical emergency that requires immediate treatment to prevent permanent damage to the heart muscle. What causes angina? Angina is caused by a reduced blood flow to the heart muscle, which is usually due to the narrowing or blockage of the coronary arteries, the blood vessels that supply blood to the heart. The most common cause of coronary artery disease, CAD, which is the underlying condition that leads to angina, is the buildup of fatty deposits, plaque, in the inner lining of the arteries. Plaque buildup in the coronary arteries can narrow the blood vessels and reduce blood flow to the heart muscle, especially during physical or emotional stress, when the heart needs more oxygen and nutrients. This reduced blood flow to the heart muscle can cause chest pain or discomfort, which is the main symptom of angina. Several risk factors can increase the likelihood of developing CAD and angina, including high blood pressure, high cholesterol levels, smoking, diabetes, family history of heart disease, obesity or overweight, sedentary lifestyle, aging, stress. In some cases, angina may be caused by other conditions that affect the blood flow to the heart muscle, such as coronary artery spasm or microvascular dysfunction. In rare cases, angina may also be caused by other underlying conditions such as heart valve disease, cardiomyopathy, or aortic stenosis. How is angina diagnosed? The diagnosis of angina typically involves a combination of medical history, physical examination, and diagnostic tests. The goal of the diagnostic process is to determine the cause and severity of the chest pain or discomfort, and to identify any underlying conditions that may be contributing to the symptoms. Medical history and physical examination. The healthcare provider will ask about the patient's symptoms, risk factors, and medical history, including any family history of heart disease. They will also perform a physical examination, including listening to the heart and lungs, checking blood pressure, and assessing for any signs of heart disease or other medical conditions. Electrocardiogram, ECG. An ECG is a non-invasive test that measures the electrical activity of the heart. It can help detect any abnormalities in the heart rhythm or function and can be used to diagnose angina. Stress test. A stress test is a diagnostic test that measures how the heart responds to physical activity or stress. It involves monitoring the heart rate and rhythm while the patient exercises on a treadmill or stationary bike. The stress test can help diagnose angina by reproducing the chest pain or discomfort during exercise. Echocardiogram. An echocardiogram is a non-invasive test that uses ultrasound waves to produce images of the heart. It can help evaluate the heart's function and detect any abnormalities that may be contributing to the symptoms. Coronary angiography. Coronary angiography is an invasive test that involves injecting a contrast dye into the coronary arteries and using X-rays to visualize the blood flow through the arteries. It can help identify any blockages or narrowing of the arteries that may be causing angina. Other diagnostic tests that may be used to evaluate angina include blood tests to measure cholesterol levels and markers of heart damage, cardiac MRI, CT angiography, and coronary calcium scan. The specific diagnostic tests used may vary depending on the patient's symptoms, risk factors, and medical history. The healthcare provider will determine the most appropriate tests based on the individual patient's needs. How is angina treated? The treatment of angina typically involves a combination of medication, lifestyle changes, and, in some cases, medical procedures. The goals of treatment are to relieve symptoms, reduce the frequency and severity of angina episodes, and prevent complications such as heart attack. Medication. The most commonly used medications for the treatment of angina include nitrates. Nitrates, such as nitroglycerin, work by relaxing the blood vessels, increasing blood flow to the heart, and reducing the workload on the heart. Beta blockers. Beta blockers reduce the heart rate and the workload of the heart, which can help relieve angina symptoms. Calcium channel blockers. Calcium channel blockers also help relax the blood vessels, reducing the workload of the heart and improving blood flow to the heart. Aspirin. Aspirin can help prevent blood clots from forming and reduce the risk of heart attack. Lifestyle changes. Lifestyle changes that can help reduce the frequency and severity of angina episodes include quitting smoking. Smoking is a major risk factor for heart disease and can worsen angina symptoms. Eating a healthy diet that is low in saturated fat, cholesterol, and salt can help lower blood pressure, reduce cholesterol levels, and improve overall heart health. Exercising regularly. Regular exercise can help improve cardiovascular fitness, reduce stress, and improve blood flow to the heart. Managing stress. Stress can trigger angina episodes, so finding ways to manage stress, such as relaxation techniques, meditation, or counseling, can be helpful. Medical procedures. In some cases, medical procedures may be necessary to treat angina, such as angioplasty. Angioplasty is a minimally invasive procedure that involves using a balloon catheter to open up a blocked or narrowed coronary artery. Coronary artery bypass graft, CABG, surgery. CABG surgery involves bypassing a blocked or narrowed coronary artery by using a blood vessel from another part of the body to create a new pathway for blood flow to the heart. ECP, Enhanced External Counterpulsation, EECP, is a non-invasive procedure that is used to treat angina and other cardiovascular conditions. It involves the use of inflatable cuffs that are wrapped around the lower legs, thighs, and buttocks, which are then inflated and deflated in a timed sequence to increase blood flow to the heart. During ECP, the cuffs inflate during diastole, which is the resting phase of the cardiac cycle when the heart is filling with blood. The inflation creates pressure that pushes blood back toward the heart and increases blood flow to the coronary arteries, which can improve oxygen delivery to the heart muscle. ECP is typically done as an outpatient procedure and does not require sedation or anesthesia. A typical course of treatment involves 35 one-hour sessions, which are usually done 5 days a week for 7 weeks. ECP has been shown to be effective in relieving angina symptoms in some people, although it is not appropriate for everyone. It is typically used as a treatment option for people who have not responded well to other treatments, or who are not good candidates for more invasive procedures such as angioplasty or bypass surgery. As with any medical procedure, there are risks and potential side effects associated with ECP, and it is important to discuss the risks and benefits with your healthcare provider before undergoing the procedure. The specific treatment approach used will depend on the severity and underlying cause of angina, as well as the patient's overall health and medical history. What can I do at home to manage angina? Follow your healthcare provider's treatment plan. It is important to take any medications as prescribed by your healthcare provider and to follow any other recommendations. Quit smoking. Smoking is a major risk factor for heart disease and can worsen angina symptoms. Eat a healthy diet. A healthy diet that is low in saturated fat, cholesterol, and salt can help lower blood pressure, reduce cholesterol levels. Exercise regularly. Regular exercise can help improve cardiovascular fitness, reduce stress, and improve blood flow to the heart. Manage stress. Stress can trigger angina episodes, so finding ways to manage stress, such as relaxation techniques, meditation, or counseling, can be helpful. Know when to seek emergency care. If you experience severe or prolonged chest pain or discomfort that is not relieved by medication or rest, or if you have other symptoms such as shortness of breath or nausea, seek emergency medical attention right away. What is the prognosis for angina? The prognosis for angina depends on several factors, including the underlying cause of the condition, the severity and frequency of symptoms, and the effectiveness of treatment. In general, angina is a chronic condition that requires ongoing management to control symptoms and reduce the risk of complications. With appropriate treatment and lifestyle changes, most people with angina are able to control their symptoms and maintain good quality of life. However, angina can be a sign of underlying heart disease, and people with angina may be at increased risk for heart attack, stroke, and other cardiovascular events. The prognosis for angina is generally better for people who are able to make lifestyle changes, such as quitting smoking, eating a healthy diet, and exercising regularly. Medications such as beta blockers, calcium channel blockers, and nitrates can also be effective in reducing symptoms and improving overall heart health. For people with severe or unstable angina, or those who have not responded well to other treatments, more invasive procedures such as angioplasty or bypass surgery may be necessary. These procedures can be effective in improving blood flow to the heart and reducing the risk of complications, but they also carry some risks. It is important to work closely with your healthcare provider to develop a management plan for your angina that is tailored to your individual needs and medical history. With proper management, most people with angina are able to maintain good quality of life and reduce the risk of complications.